Look, I can imagine that. And before I go back to Celestine, I just wanted to ask you mentioned you go to uni, and now I think you're studying English and European history. How is it working with the university in terms of their capacity to provide you with the quality of teaching you're looking for?
Oh, excellent support. I receive tactile interpreters for all lectures and tutorials. Yesterday I had exam in European Studies, and
how'd you go?
Okay, I think I did okay. Yeah, I think I did okay. But even to sort of to go as far as I have done, I think it's really important that if I didn't have Able Australia behind me to give me the initial skills to go further and to link in with other organisations, I dare say I would have been at home so many. I think there's so many hidden deafblind people that really still have not been identified as being deafblind. I think it's really important that we have had the service where we can link in with the community.
Look, absolutely. And Michelle, thank you for that lovely segue back to Celestine, because I wanted to ask you, Celestine, there's clearly a big unmet need. You also say in your notes that for some people the amount of government support they get is no more than 3 hours a week, and we can clearly hear from both Heather and Michelle how critical that support is to just them getting about their daily lives. How do we turn this around?
Look, Robin, I think by radio programs such as this and during Deafblind Awareness Week, we are doing a number of national radio interviews, and I'll be appearing on Sky Channel in Sydney on Sunday morning. And I think the more that we can get out to the general public, the better it will be for the organisation down the future.
Because presumably a lot of the focus of the Awareness Week is you want to raise, you need to raise funds, obviously, to assist, but is it also about, for example, the new National Disability Insurance Scheme? Is that something Able Australia is quite interested in seeing come to fruition?
Yes, I think that's a desperate need, Robin, and I think there's a lot of groundwork yet to be done on that, because I think it involves a number of the funding arrangements that people with disabilities have at the moment. When you look at the disability pension and so forth, how will it affect that? It will be like a private health insurance scheme, but we really don't know what's involved in the fine print at this stage. But certainly I and many others of my colleagues think it would be an enormous benefit for people with disabilities in this country.
Is there a situation where people who are deafblind fall between the cracks in terms of the support being directed perhaps more to single sensory loss? Is there something that needs to be addressed there?
What I find staggering, Robin, is that almost every week I speak to someone who will say to me, "You don't mean somebody has vision and hearing loss. You only mean they're deaf or they're blind." And this is what I find absolutely astounding. So what it also says to me is that that
people don't think it's possible.
It's not possible. That's right. Or it's just lack of awareness. I think that this does happen. And look, I think there's a lot of education to be done to government departments about the disability. I think it gets a little bit too hard for them to comprehend, or what basket do deaf-blind people fit into? What funding basket mainly? And look, we have some very, very tragic situations that we're faced with from week to week, especially tiny babies that are born deaf-blind. And as you can imagine, the mums are in a state of despair. Where do they go if they can't come to us? And 3 hours a week doesn't do very much for those people.
No, I mean, I find it extraordinary that the situation actually exists, that it's 3 hours a week. So that means people are essentially calling on Able Australia, but then also perhaps drawing on their own funds and their family and friends for support. Is that right?
Yes, and of course there's a limited amount of those, as you can well imagine.
Yeah.
And we, of course, we have to pay our staff, so we have to, there's always the opportunity for fee for service, but when you take wage costs of today's standards, we would have to charge an enormous amount to an individual to cover all the costs that we have to cover as an organisation. So we really need to keep on the bandwagon about speaking to government people that make decisions, and continuing to speak to people like yourself on radio stations about the desperate need, the financial support that we need to keep providing support.
Heather, can I ask you, what do you want to see happen in the future for both yourself in your own life and for, if I can say, your fellow travellers, I suppose?
Look, I'd like to see more community involvement for deafblind people. I know other deafblind people that need more support services. I'd like to see people have better quality of life, be able to access services and be part of their community, the same as I try to and Michelle tries to. But without those support services, that's very, very difficult. You need to have the best possible support to be able to have a good quality of life. If we're involved in the community and we're doing things, then that will promote awareness as well. So it's a cycle. So I really think that more education, more awareness, more support services. We're very lucky that Michelle and I are on the Victorian Deafblind Advocacy Council, and hopefully, we'll be able to see things happening.
I'm interested, what is it, and I'll ask Michelle as well, but what is it about you and Michelle that has, I guess, driven you, and what supports have been in place so that you find yourself, as an advocate?
Well, when I started to lose my vision and become a deafblind person, I had absolutely no confidence in myself, no idea what was going on. And then I started to receive some services and learn, and I started to understand that regardless of what was happening in my life, I can do things. I can do things for myself, and I started to think, well, what about those other deafblind people? They need to have opportunities. I should be able to have the same opportunities as other people, and I've just moved on from there.
Yes, I think it's really important. Where do we go from here? What do we want to achieve? Privately, I want to achieve to finish my degree at La Trobe, and I hope to one day teach particularly English and history to people who have not had the same opportunities. However, I wanted to have a similar system to how it is in England. In England, they have the organisation like Able Australia, it's called Sense, and they actually have a system where support for deafblind people in England provided by local authorities is written into the local authority health acts, so that they cannot sort of squirm out of saying we don't have enough money to support deafblind people or we don't have enough professionals. The Act in England is actually written into legislation, so the councils must provide professionals and services of people in England. I want to see something similar where governments must be responsible, no matter whether in Victoria, New South Wales, Queensland, where governments must provide services to make sure deafblind people receive the appropriate services and professionals that they need to lead a fully independent life. I don't know perhaps whether Celestine agrees with what I'm saying here, but I think it's really important that, like for instance, getting our message out to government, which Heather and I so desperate, and also Celestine, we're all trying so desperately to do. Last October, I appeared on Q&A ABC TV and asked Bill Shorten about, how are they going to actually help deafblind people by giving more money, and he actually, unfortunately, sort of identified saying there's not many people who are deafblind, and as we've heard today, of the amount of people that lives will be impacted of deafblindness. I just sort of think we just need to get that message and say it again and again and again.